So as a professional, you must have come across a lot of pain for you or your students. How do you manage that?
Namaskaram. As a dancer, first because I was very overconfident because one thing, I used to do kalari, yoga, and so many other discipline when I was small. So overconfident, I never thought anything I'll get, any problem I get in my body. Then I used to overwork, overdo a lot of productions and dancing and everything. Then this overconfidence, the end came in 2009 when I got pain. While I was riding my bike, suddenly I don't feel both of leg. It was numbness and I don't feel the brake or clutch. It was so traumatizing. Then
Keep your
somehow,
mic closer.
somehow I remember that holding the electric post and being there, and I called my friend, he came. Then somehow I went home. A similar thing happened again, one of the production I was doing. Then I went to a doctor, and that was shocking. Then he told me that I can't dance anymore. That is, I mean, again, I got a lot of anxiety. Then I don't know my future, was completely blinded. And it was for 3 months I was completely traumatized. Then I met one doctor, his Ayurveda doctor, and he gave me a little confidence. Then I did 3 years of Ayurveda treatment, and that discipline made to understand my body and how to respect my body, and how do I daily navigate entire thing, like how do I do my exercise, how I sleep, how long I to sleep, what kind of food I need to take. All those discipline I learned later stage, it helped me a lot. Then I see similar problem to the kids, but doctor said the same thing. We believe also because they sit longer time. So whenever they come, the small kids also having the same issues, back pain, neck pain, especially they cannot hold their, because for dancing you need the entire body, very accurate. I mean, the muscle need to be very, very flexible and strong, both.
Thank you. Thank you. What are the problems to people in fitness who take up running? What do they face with back and neck?
So most of the problems, mostly we have this upper back issues as runners, but I think it's primarily because of wrong running technique and wrong posture. But end of the day, we're all recreational runners. So it's a paradox. Running is a paradox. As much as we say it's easy, there are also a lot of things that you have to follow the guidelines. But it's very difficult to follow the guidelines all the time and keep your head straight, keep your spine straight, and keep your hands straight and all that. So end of the day, I think it's more of getting basic things right. And most important is strength and conditioning that will complement the running part of it. Because running is picked up big time in India. When we all started many years back, I'm talking about 13, 14 years back, very few runners on the road, especially women. But now almost everywhere you find runners. So it's very important that we give a lot of importance to strength and conditioning and take it by the year. It's very, it's crucial to know that there are certain things that we can do, there are certain things that we cannot do. So back pain, when it comes to back pain, it's mostly the upper back and inflammation, there's cramps. Not a day goes by when I wake up in the morning without pain. There's some discomfort, there's some pain. But at the end of the day, can I just keep running? And at this point of time, I think we're only looking at recreational running. Yeah.
Thank you. So you're an sports medicine specialist. How does improper training techniques, people are now all into the gym and sports. Young kids are all into sports. What do they have to do? What do you see?
Yeah. Hi. So basically, exercise is medicine. Exercise is medicine. So everybody,
You can keep your mic closer to you.
right from kids to senior citizens, whether they are sportsmen or not, they need to do exercise. But when they do the exercise, you need to know the right technique to do it. So when we talk about technique, regarding spine, the most important aspect is the mechanics of the spine. So you need to know the activity, whether if you are a gym goer, you need to know the proper lifting techniques. Say if you're going to increase your flexion level, if you don't have a proper technique in lifting the weights, that can put a lot of stress in the spine, and that may lead to a lot of disc issues or other spinal pathologies. So understanding the biomechanics of that particular sporting activity or the gym activity is very important. So one small tip I would like to give, whether you're an athlete or a common person, understand how to do a simple lifting technique. So remember, more the object is away from your body, try to lift the object as close to your body as possible, okay? So even if it is a senior citizen who is trying to lift your grandchild, or an energetic sportsman who is going to lift a heavy weight, try to keep the object or the body close to yourself, so that will reduce the spinal pressure, the disc pressure will be less, and the spine muscles, very, very important is the spinal muscles, that will have less load. So understanding the proper mechanics of that sport and understanding proper lifting technique is very important in gym course. Thank you.
Thank you. So what is sciatica?
I'll answer in Tamil because then I
சொல்லுங்க.
don't think you'll have to translate.
கண்டிப்பா.
Yeah. நம்ம இடுப்புலேருந்து காலுக்கு சயாட்டிக் நர்வ் அப்படின்னு ஒன்று போகுது. ஸோ அதுதான் வந்து காலுக்கு உணர்ச்சி, பலன், இந்த மோட்டார் ஆக்டிவிட்டி எல்லாம் கொடுக்கறது. When this nerve gets compressed, நர்வ்னா நம்ம வந்து டைரெக்டாக நர்வ் கம்ப்ரெஷன் சொல்லுது, ரூட் கெட்ஸ் கம்ப்ரெஸ், ஸ்பைனல் கார்டில் கம்ப்ரெஷன் வரும்போது இந்த நர்வ் போகிற பாதையில் ஈச் நர்வ் வில் கோ டு ஒன் பர்டிகுலர் ஏரியா ஒன்லி. ஸோ தட் இஸ் சம்திங் வி மஸ்ட் ரிமெம்பர். ஸோ அந்த ஸ்பெசிஃபிக் இடத்துல அழுத்தம் ஏற்படும் போது இந்த பெயின் ட்ராவல்ஸ் அலாங் த லெக். எல்லாரும் என்ன சொல்லுவாங்க, கரண்ட் ஷாக் அடிக்கிற மாதிரி வலி இருக்குது டாக்டர் சொல்லுவாங்க, மதன் இருக்குது, மறுத்து போகிற மாதிரி இருக்குன்னு சொல்லுவாங்க. பாரஸ்தீசியா, சென்சரி சேஞ்சஸ், இல்லை கால் அசைவுகளில் தளர்ச்சி இருக்குது, படி ஏறும்போது கால் தட்டுது, ஃபுட் ட்ராப். ஸோ தீஸ் ஆர் ஆல் திங்ஸ் விச் ஆக்சுவலி சிக்னிஃபை அ sciatic nerve involvement. All sciatic nerve involvements are not due to disc, but a major chunk of sciatic nerve involvement is due to disc involvement.
டாக்டர் அசோக், நீங்கள் வந்து ஒரு ஓரோமாக்சுவல் சர்ஜன். ஸோ நிறைய சர்ஜரி, நானும் சர்ஜன், நம்ம குனிஞ்சு நின்றுக்கிட்டே வேலை செய்கிறோம் a lot of time. So how has that affected you?
Dentistry is back-breaking. So don't haggle with your dentist. In a recent study, it was found that 70% of dentists had back pain. 50% of those dentists had lower backache. And 90.5% of them had moderate pain, and 9.5% of patients had severe backache. The primary cause is prolonged standing, awkward working posture. It's not easy to do dentistry. You're always working in a dark area with a compromised light, and a fussy patient under local anesthesia keeps closing the mouth. And if you're doing a root canal or a crown or a wisdom tooth surgery, you have to go that far. So you're always straining your neck, and you're always in an awkward posture. A lot of people do sitting dentistry, and they try to lean on the patient. So when they lean on the patient, they cause strain of the lower back muscles and an imbalance between the abdominal muscle and the lower back. So these are the primary causes. I mean, I've also suffered as a dentist. I had 10 years of back pain, 5 years of severe backache, and thanks to Dr. Bala and his fantastic team, I had a successful spine surgery in 2019, and I'm celebrating, thanks to you, sir, 5 years of pain-free life as a dentist. I'm not here for any advertisement.
Thank you.
But I'm eternally grateful to the spine fraternity. Thank you very much.
So, Dr. Gururaj, now, one of the things we see nowadays is young IT professionals, and they have a lot of back pain. Why is that so?
Okay, I do have OPDs on like Tuesday, Thursdays, and Saturdays. And my Saturday OPDs are always full with these IT professionals because they have holiday on that day, and they drop into your OPDs. Mostly they have low back pain, or they have a lower neck pain. Like previously I was telling, the sitting on the chair or sitting anywhere, especially sitting cross-legged on the floor, which we think which is very good, puts a lot of pressure on your back, lot of pressure on your discs, and lot of pressure on there are small joints in the spine. So these all get affected when you sit for long time at one place in one posture. So sitting has the maximum amount of pressure on your back. That is why these professionals ultimately have back stiffness, back pain, slip disc problems, back strains especially, and they come. So that is why this couch potato thing, this is like we wanted to say that it is equal to smoking, because smoking causes all chronic problems like heart disease, BP, diabetes. Same way, sitting also causes same blood pressure issues, diabetes, and added to that back pain and neck pain. So always I would tell my patients that if you sit for half an hour, 40 minutes, just get up and stand or walk for 2-3 minutes and come back and sit. That will keep your back healthy. Thank you.
Thank you. Next question is to Rekha. See, when you're running, is footwear important, the choice of footwear? Sila time, people run barefoot. People do all kinds of things. What's the right thing?
No, actually footwear and related to this conclave here, footwear, back pain, neck pain are not related. Wrong posture, overloading, and excessive running. This can be compounded with, your choice of shoes. So just to take this back, say 2008-9 I think we led a very simple life. We didn't know anything. We just bought some shoes. We just started running, Garmin watch, so we were very happy. And then I think we crossed over to the dark side. So now we weigh the shoes, it's all that is happening. But at the end of the day, I think it's more of what suits you best. So otherwise, I don't think footwear is not directly related to neck pain or back pain, sure. But we do choose our footwear to our convenience.
Sure. Dr. Jasper, back pain we see in a lot of people, and when is it serious? When do they have to go and see someone? Or should we just ignore?
Back pain is a very common problem, but we have what we call as red flags or danger signs. The danger signs we have to meet the doctor. First danger sign is pain, very severe pain, which affects your day-to-day life. My sleep is disturbed because of my back pain. That is one important reason. Second is if you have new or progressive neurological deficits. Already konja kaal thalarchi irkalam. Then you start developing more weakness, kaal no mosamaagalam. Illa bowel and bladder, urinary frequency changes, urinary control changes. Indha madhi vandalum kandipa ponom. Thirdly, if night sweating, night odambala verkudhu, weight loss, loss of appetite, fever, all these are also important signs. And another one common problem that we see is lots of patients are on cardiac drugs. So aspirin, cloplet, ratham orairada kammi pandra drugs, Brilinta, idallam potalum, or chronic steroid use. All these can also be red flags for back pain.
Thank you. Intajit, I would like to ask you, what is your experience with back pain? Because you trained all over the world. And how do you manage that?
Hello, everybody. And thank you for making me part of this event. And I'm from North India, so it is like something I'm missing here, like some language and that type. And first of all, sir is asking that how much it is disturbing and how's the life going on with the back pain. So I'm doing my athletic sports shot put from last 25 years. So in 25 years, the shot put is strongman game and we have to do very rough training, even it is explosive training or it is strength training or with the shot also. Most of you know how much it is heavy, we have to put here and throw. So all the time we are like our knees, our back, everything is, we are going with the rough training. So it is not easy to be there, and few of the points I would like to put on here, that eating habit, how much like protein, carbs, fat we are putting in our body is very important. Second thing, if we want to save our back, we have to balance our body, whether this leg is stronger or that leg is, whether our shoulder is weak or bi area is weak, all the muscles should be in balanced way. If our one hip is weaker and another is stronger, one is not working like somewhere our central, it is not connecting with our central nervous system, it will get weaker because of some pain, like that things. So we have to understand all these things, and the most important is flexibility in your body. You are seeing me, I am 140 kg with a weight, and my flexibility is like, you will see that this much he can flexible. So if you are not flexible, your back will hurt, you will get pain in your body, in your knee. If your ankle is not mobilized or it is not like flexible, then it will be a problem for you in future, because then one thing is not working, some problem will come to your back. If mid back is stiff, your lower back will work more, it will go to a bad stage. So somewhere we have to understand this whole scenario is that our core should be very strong, this will support your back. Then our glutes, both the glutes, these are the pillars for our back spine. If these two things are weaker, going bad day by day, or your habits, you are not disciplined in your diet, you are not going for any physical activities, so this will go worst day by day. So these are few of the things I feel, being in sports from last 25 years, we have to take care of all this.
What preventive measures should gym goers go? A quick answer, please.
So for athletes or for gym goers, two main things. The basics have to be handled properly, like a good warm up and a good warm down routine. But when it comes to spine and neck issues, I rarely see anybody doing a good quality spine warm up. Okay, so typically a warm up would be a regular few arm swings, simple lower limb stretches, and whether you're a racket sportsman or a runner, you're off into the activity. But you need to be aware that spine is supported by very important 29 muscles, which forms the core. Okay, so core and trunk is formed by a very large group of muscles in the upper back, parascapular muscles, the front abdominal muscles. In the gym, what happens is typically they only train the aesthetic muscles or the cosmetic muscles, which are looking what we call as a six-pack muscle. But if you chronically overdo those training, then the deep core muscles, which are the muscles which stabilize the spine and prevent any injury from happening to the spine, that gets affected. So remember to train the deep muscles also. Okay, simple TA activation, bracing, our ancient yoga techniques, these are very, very effective in preventing any injuries to the spine. Similarly, one more important thing for sedentary people and increased usage of tech is causing a lot of upper neck issues with forward neck posture. Okay, here also you need to be really smart, ensure that you are constantly moving. Movement is medicine, and learn simple stretches and strengthening exercises so that you prevent spinal pathologies. So to conclude, exercise is medicine, and exercise is medicine for spine.